Hey everyone, and welcome to this explainer. So, are you a Connecticut resident feeling, well, maybe just a little bit overwhelmed by the whole idea of applying for health insurance? If you are, trust me, you are absolutely not alone. Our goal today is completely demystifying the health insurance application process for Connecticut residents. We're going to break down exactly what you need to do step by step to get the coverage you absolutely deserve.
But first, I want you to ask yourself a serious question. What happens if a sudden medical emergency strikes tomorrow? Seriously, imagine not just the physical shock of an unexpected injury or illness, but the immediate, crushing financial panic that follows when you realize, oh no, I'm uninsured and I'm on the hook for thousands of dollars. It is a terrifying scenario. But the good news is, it's one we can completely prevent with just a little bit of proactive planning today.
Okay, let's dive right into this. Having health insurance is about so much more than just keeping a piece of plastic in your wallet. It provides absolutely crucial financial and physical peace of mind. It's your ultimate safety net. It protects you from the skyrocketing costs of unexpected medical bills, all while making sure you actually have access to preventative care when you need it most.
Now, to get that safety net here in Connecticut, you've got to know about Access Health CT. Born from the Affordable Care Act, this official marketplace is basically the singular gateway for state residents to access state subsidies, Medicaid or Husky Health programs, and private health plans. And here is the most important part. It is the absolute only place where you can qualify for financial help to lower your monthly costs.
So, here is our roadmap for today. We'll be looking at why health insurance matters, eligibility and preparation, the application process, choosing the right plan, and finally deadlines and free resources. Breaking it down this way makes getting covered totally manageable.
Let's kick things off with Section 1, Why Health Insurance Matters. We're going to look at the essential benefits that impact your daily life.
You know, every single standard plan offered through Access Health CT legally must cover these 10 essential health benefits. We're talking about guaranteed coverage that really spans your entire life cycle. It covers routine annual checkups and vaccines to keep you healthy, right up to emergency room visits and hospitalization if the unexpected happens. It also guarantees coverage for your prescription drugs, mental health services, substance abuse treatment, maternity and newborn care, and even pediatric services for the little ones. It's basically a comprehensive shield protecting you at every stage of life.
Moving right along to Section 2, Eligibility and Preparation. Let's look at who can apply and what you need to have ready before you start.
So who actually qualifies to apply through this marketplace? Well, you just have to meet a few basic eligibility requirements. First off, you must be a Connecticut resident. You also need to be lawfully present in the United States, meaning you're a citizen, a national, or you hold a valid immigration status. You must be non-incarcerated. And finally, you cannot be currently enrolled in other comprehensive minimum essential coverage. That means things like Medicare, TRICARE, or a robust employer-sponsored plan. Basically, this marketplace is designed specifically as a lifeline for folks who don't already have existing coverage.
Now, if you meet those requirements, here is a huge pro tip to make the whole application process completely frictionless. Gather your documents right now. This pre-application checklist is your best friend. You are going to need exact dates of birth and social security numbers for all household members applying. If it applies to your situation, grab your visa, green card, or immigration documents too. Crucially, you need proof of income. Think along the lines of your most recent Form W-2, your 1040 tax return, 1099s, recent pay stubs, or profit and loss statements. Literally, having these stacked on your desk before you begin will save you so much time.
Okay, on to Section 3, the application process. This is your step-by-step guide to actually getting covered.
I promise the mechanics here are way easier than you might think. Step 1. Just create an online account at accesshealthct.com. Make sure to use your exact legal name so it matches your IDs perfectly, and pick a secure password. Step 2. Now, if you've already started an application over the phone with a rep, you'll want to link that existing application to your online account using your application ID. That keeps the whole shebang organized. Okay, Step 3 is where the magic happens. You input all that household and income information we just gathered. This is how the system determines your eligibility for subsidies or Medicaid. And finally, Step 4, submit that application. From there, you get to view, shop, and compare the specific qualifying plan options tailored just for you.
Which brings us to Section 4, Choosing the Right Plan. Let's focus on maximizing your plan's value and utilizing that financial help.
Before you click select on any plan, I need you to remember this absolutely crucial piece of advice. We call it the golden rule. Look beyond the monthly premium. You have to make sure it covers your doctors, your prescription drugs, and your expected medical services.
A cheap monthly premium might look incredibly tempting on the screen, but if your specific doctor isn't in network or your daily medication isn't covered, that quote-unquote cheap plan could actually cost you thousands out of pocket. So always verify your network and your formulary first.
Once you've checked to make sure your doctors are covered, you'll see the plans broken down into metal tiers. These basically show the trade-offs between what you pay monthly and what you pay out of pocket when you get care. Bronze plans have the lowest monthly premiums, but the highest out-of-pocket costs when you actually go to the doctor. They're usually best for, say, a healthy 20-something who really just wants an emergency backup. Gold plans are the exact opposite, highest monthly premiums but lowest out-of-pocket costs, making them ideal if you have regular medical needs or expensive prescriptions. And sitting right there in the middle is silver. Silver is kind of the sweet spot for most buyers. It has moderate costs, and honestly, you're often required to pick a silver plan to unlock specific financial help like cost-sharing reductions.
Now, speaking of financial help, take a look at this number. $0. Literally zero. For eligible Connecticut residents whose income is under 175% of the federal poverty level, the covered CT program steps right in. If you qualify for this, you pay exactly $0 for your monthly premiums and $0 for out-of-pocket costs like deductibles and copays. It even throws in dental and medical transportation benefits at no additional cost. No way, right? It's amazing.
But you might be wondering, what if my income is just a little bit higher? Well, Connecticut recently introduced the 2026 Temporary Premium Assistance Program. This is a limited-time initiative that was designed to replace some recently expired federal tax credits. If your household income is between 100% and 200% of the federal poverty level, this assistance replaces 100% of those expired credits. If you're sitting between 400% and 500%, it replaces 50%. It is literally saving residents millions of dollars. But there is a catch. You generally must call 1-855-805-4325 to enroll in the specific limited-time program.
All right, last but definitely not least, Section 5, Deadlines and Free Resources. You have to act within specific enrollment windows, so let's talk about taking action and finding help.
Timing is literally everything when it comes to health insurance. Here is your critical timeline for the 2027 open enrollment period. Definitely mark your calendars for this. October 23, 2026 is when open enrollment officially begins. That gives you an early start to shop around. Now, if you want your coverage to start right on New Year's Day, January 1st, 2027, you absolutely must enroll by December 15, 2026. And the final hard deadline to enroll for 2027 coverage is January 15, 2027. Missing these dates could mean waiting an entire year for coverage, unless you happen to experience a qualifying life event.
Listen, if you are looking at all this and feeling a bit stuck, just take a deep breath. Completely free, expert help is available to you. You can call 1-855-805-4325, and they have enrollment specialists who can assist you in over 100 languages. If you are hearing impaired, the TTY number is 1-855-789-2428. You can also just use the live chat feature online at accesshealthct.com. You can even meet with free, in-person navigators at 6 locations statewide, or find a certified broker in your area who will help you compare plans and figure out your subsidies at absolutely zero cost to you.
Before we wrap things up today, I do need to give a quick professional disclaimer. The information presented in this explainer is accurate as of August 15, 2026. Because healthcare policies, income thresholds, and specific assistance programs can and do shift, you should always verify all updates, deadlines, and your specific eligibility directly with official Access Health CT resources before making your final decisions.
We've covered a lot of ground today, from understanding those essential benefits to pulling together your documents and hitting those critical deadlines. Your health and financial security are completely in your hands. So, what step will you take today to protect your tomorrow? I highly encourage you to go gather those documents right now and visit accesshealthct.com to get your application started. Thank you so much for joining me on this explainer, and hey, here's to a healthy, secure future.